Hello, good morning students. This is Dr. Amit here, Department of Anatomy, Associate Professor. Now we will discuss about today. We will discuss about the scapula. So that is a triangular flat bone. It is a triangular flat bone which is situated on the posterolateral aspect of the thoracic cage. You can see here. This is the thoracic cage. This is the thoracic cage, and it is the situated here. So this is the posterior side and lateral side. So it is situated at the posterolateral aspect of the thoracic cage. So we have I have told you that it is a triangular bone, okay, triangular flat bone. And so here you will find the three angles. In this bone you will find the three angles and three borders, three processes and two surfaces. So all the three angles are there: superior angle, inferior angle and lateral angle. So three angles are there: superior angle, inferior angle, lateral angle. Lateral angle is broadened and it forms the cavity that is called as glenoid cavity. That glenoid cavity articulates with the head of the humerus and form the shoulder joint. So lateral angle is wide and broad and form a glenoid cavity which forms the shoulder joint by articulating with the head of the humerus. Then superior angle, inferior angle and lateral angle. Three angles. Now we will talk about the three borders. So you will find a thin sharp border which extends from the superior angle to the lateral angle. Here you will find a sharp border, that is the superior border, which is marked by a notch that is called as suprascapular notch. In between the superior angle to the inferior angle, you will find a border that is called as medial border. You will find a medial border, and which is thin. Medial border is thin and extend from the superior angle to the inferior angle. Lateral border is the thickest border of all. Lateral border extends from the glenoid cavity to the inferior angle. It is the thick border. Okay. Now, this is a left-sided. Now we'll talk about the side determination actually. So first of all, we have identified the bone, that is a triangular flat bone situated on the posterolateral aspect of the thoracic cage. So that is a scapula. Okay, and now we will talk about the side determination. This is a left-sided scapula. How? The lateral angle is wide and broad. The lateral end is broad and form the glenoid cavity. So you will find this glenoid cavity will be on the lateral side. Okay. Superior border will marked by a notch that is called a suprascapular notch. Anterior surface is concave forward, and posterior surface you will find is divided into the two parts by a triangular bony plate that is called the spine. So posterior surface will bear a spine. Lateral angle is widened and form glenoid cavity, and anterior surface concave forward, and superior border bears a suprascapular. So in this way we will see all the points. It is a left-sided scapula. Done. So in the features we have already discussed about the three angles and three borders. Okay. So this is the superior angle, inferior angle, lateral angle. Bears a cavity, glenoid cavity. Superior border thin, sharp, and it has a suprascapular notch. Medial border, which extends from the superior angle to the inferior angle, is a thin, and lateral border extends from the glenoid cavity to the inferior angle, which is the thickest border. Okay. Then now we will talk about the three processes. So you will at the posterior aspect you will find the posterior surface is divided into the two fossas, that is supraspinous fossa and infraspinous fossa, by a triangular thin bony plate. So here you will see there is a triangular thin bony plate. It is called the spine of the scapula. So one process is the spine of the scapula. What is the spine of the scapula? Spine of the scapula is a triangular thin bony plate which divides posterior surface into the two parts, upper parts and lower parts. Okay. So this triangular thin bony plate is called the spine. Now, further extension of this process, you will find a process that is called as acromion process. You will find here a acromion process which is just above the glenoid cavity. So the acromion process will bear two borders and two surfaces. You can see here. You can see here this border is called as medial border. Medial border, and this is the lateral border. Two surfaces, superior surface and inferior surface. So now this is the second process. The first of all we have discussed about the first process, that is the spine of the scapula. Spine of the scapula has the three borders and two surfaces. Okay. So three borders you will find the posterior border of the scapula, spine of the scapula is called as crest. Posterior border is thick and it is called as crest of the spine. So this is the crest of the spine. It has two lips. Okay, the crest of the spine has two lips, upper lip and lower lip. So now, and the spine has the two surfaces, that is the superior surface, upper side, upper side you will find the superior surface, inferior surface, anterior border, posterior border is thick and it is called as crest of the spine, and lateral border. Here you will find the lateral border. So just things to be remember that it has three borders and two surfaces. Posterior border is thick and it is called as crest of the spine, and posterior border has two lips, upper lip and lower. Okay. Now the continuation will lead to the one more process, that is called as acromion process. Just above the glenoid cavity, it has two borders and two surfaces, medial border and lateral border, superior surface and inferior surface. Okay, so two surface, two border. Now one more process in front of the acromion process, that is called as coracoid process. It has also the same borders, that is the medial border and lateral border, superior surface and inferior surface. So we have the three processes. What were those processes? Spine of the scapula, which bears a crest with upper lip and lower lip. Second process, acromion process, has the medial border, lateral border, superior surface, inferior surface, and one more surface is coracoid process. Done. There is a notch in between the spine and the glenoid cavity, that is also called as spinoglenoid notch. Okay, so you will find a notch here in between the spine and the glenoid cavity. So this notch is called as spinoglenoid notch. And at the superior border you will find a notch, that is called as suprascapular notch. So two notches you will find. Now we will talk about the tubercles. The glenoid cavity, which articulates with the head of the human, which form the shoulder joint, bears two tubercles. So one tubercle is just above the glenoid cavity, that is called as supraglenoid tubercle, and one tubercle which is below the glenoid cavity, that is called as infraglenoid tubercle. Done. So here we have discussed about almost all the features of this bone. So now it is almost complete. The features of the scapula bone is almost complete. Now we will discuss about the muscle attachment in the next video.